The Health Inequalities Summit brought together a whole range of stakeholders at the historic Toynbee Hall in London's East End. The aim to highlight the contribution of community pharmacy to addressing health inequalities and to take on the question, what needs to happen now to deliver a step change in support of those communities who need it most? Chaired by the political journalist Michael White, the summit kicked off by reflecting on the stubborn health inequalities gap and the scale of the challenge remaining.
The gap between somebody, we all know the stats, somebody born in East Manchester and somebody born in Kensington, and life expectancy still 8 or 9 years.
With so much still to do, pharmacy stands ready to take its contribution to the next level.
We know that many pharmacies across the country are actually engaging in stop smoking services, in weight management, in reduction of alcohol strategies. What we would like to see is for every pharmacy in every part of the country engaging in a consistent manner and not just some pharmacies in some parts of the country.
I would say to you, choose pharmacy. You know it makes sense.
I'm one of the newly trained health trainers in Tower Hamlet. The pharmacies coming into starting work with the Healthy Living Programme is going to be an extra boost to the work that we're doing already.
The message was clear. Increased public investment in community pharmacy would bring a wider range of NHS services into the heart of the communities that need it most, addressing the health inequalities issue head on.
And I would suggest that pharmacy now has probably got the most experience of managing to tighter funding than any other part of the NHS. Pharmacy must demonstrate to the SHAs, to the PCTs, what can be done, but it should be done by a strong voice joined together in pharmacies.
Well, we were very supportive of much of what was in the pharmacy white paper, and we think pharmacists have a significantly enhanced role over and above the services that they're providing at the moment. So that's not just providing greater amounts of information to patients, but it's also providing additional services, whether that be cardiovascular screening, but also working much closer together with GPs to make sure that the whole of primary care is integrated.
From my point of view, I've greatly enjoyed the day. I've actually learnt a whole raft of new things. I think the capabilities within community pharmacy and the untapped resource, I think, is equally immense. And that means in so many areas, and all the things we've heard today about raising or narrowing the gap between the provision of health to deprived areas versus more affluent areas, community pharmacy is absolutely right in the centre of those communities. And one of the key aspects has been the accessibility. So all the services that are available out through community pharmacies will absolutely be going to the right areas. Across the whole range of inequalities, community pharmacy is the right place to be delivering those.